Hi everyone. In this video we are going to learn about the metered dose inhaler, which is one of the method of medication administration through inhalation. I am Jenilyn Bernard, working as tutor in MMM College of Nursing. In this session we are going to learn about the inhalation of medication and the metered dose inhaler and its different types and the patient education related to the usage of it. Medication inhalation is a method of medication administration that is through the respiratory system in the suitable form of the preparation. Very commonly we are using aerosols and dry powders for the inhalation of medication. Metered dose inhaler is a device that designed to deliver a specific amount of medication into the respiratory tract in the aerosol form upon the application. There are different types of metered dose inhalers are available. The conventional method is the pressurized metered dose inhaler, then metered dose inhaler with a spacer or holding chambers, breath activated metered dose inhaler, dry powder inhalers. Pressurized metered dose inhaler. It is a device in which the active drug along with the propellant is packed under pressure, which is released upon the application. Now we can see how the pressurized metered dose inhaler is working. It is having two main parts. Number one, it is the aluminium body which is called as canister, which contains the formulated medication along with the propellant, and it is covered by the plastic body including the mouthpiece. Through this only the medication will be entering into the mouth upon application. The propellant provides the force to generate the aerosol cloud and is also the medium in which the active components must be suspended or dissolved. So upon application, with a short burst of aerosol medicine will happen, which will enter into the lungs. As we have seen, during application, when the medicine is forcefully entering into the lungs through the mouth, most of the medicines are making the impact on oropharynx. So finally, only less than 25% of medicine is entering into the lungs. It is so important to educate the patient that how to use the metered dose inhaler. Ask them to shake it gently before they are administering the medication and remove the cap from the mouthpiece and exhale deeply. Place the mouthpiece in the mouth and seal the mouthpiece with the lips closely. And they have to administer the prescribed amount of medicine by pressing it gently downwards, and they have to count till 10. That is the 10 seconds they have to deep breathe the medicine and hold it, and once it is over then they can exhale slowly. The pressurized metered dose inhaler is having many advantages. It is portable, very small and handy, very convenient to carry with the patient all the time. Even in a small purse they can place it and they can have it with them all the time. As it is portable and it is having the immediate access in case of any emergency. It is having low risk for contamination and it is available in the multi-dose form, so no need to buy each and every time. And the very important advantage is the patient can administer by themselves. They no need to get any help from the healthcare professionals, so it is easy, they can get the medicine at any time, and it is having the less chance for dosage errors. It is also having few disadvantages. The children and elderly people may find difficulty in using this because it needs the proper usage technique and the coordination, and it can cause the high pharyngeal drug deposition, and it is also having the risk associated with the flammability. One of the difficulty in the conventional method of meter dose inhaler is it is very difficult to identify the remaining dosage. But the recent MDIs are coming with the dosage indicator or dosage meter, so that the patient can able to calculate the remaining dosage and they can able to buy the new one before it is getting empty completely. Even there is a test, that is floating test, to identify the medication level in the conventional meter dose inhalers. When we put it inside a bowl of water, if the canister is full of medicine, we can see it will be resting at the bottom. Then how it is shown in the figure 4, 3 and 2, according to the level of medicine it will be floating inside the water. When the canister is completely empty, we can see the container is floating on the water surface. Next method is using the meter dose inhaler along with the spacer. The spacer is a long empty device, or we can call it as a chamber. It will be fixed along with the inhaler when the patient is using the medication. Here we can see the chamber is having the two edges. One is the inhaler adapter edge, there only the MDI will be getting connected. The other side is the mouthpiece, so through that the patient can able to inhale the medicine. When the patient is using the chamber will be having some air within that. When the medicine also administered inside, the patient can able to breathe several times as the diluted form of aerosol. So it will be more effective when we compare with the direct use of the meter dose inhaler. It is so important to educate the patient that how to use the MDA along with the chamber. First, ask the patient to remove the cap and shake the inhaler gently. Then insert the inhaler into the spacer where the adapter is given, and ask the patient to breathe out all the way and press down the medication inside and breathe slowly, and they have to hold the breath for 10 seconds. That is, after taking the medicine they can count 1 to 10, then slowly the patient has to breathe out. By using the spacer, there are many advantages. It is giving the high efficacy, and it doesn't require much skill like using the meter dose inhaler directly, and the less dosage is adequate enough to reach the lung. The impact is less with the oropharyngeal deposition, and it is suitable for the children and the elderly people. The spacer is coming with two different types of mouthpiece, that is, one is the mask type and the other one is the mouthpiece. So according to the child's age we can able to choose which type we need to buy. Then it is very difficult to make the children to inhale the medicine. So very colorful like a toy type of inhalers are available. It will be motivating the children to take their medications without much struggle. The disadvantage in using the chamber is the chamber size will be bigger, so it will not be much comfortable to carry all the time, and there will be possibility for the bacterial contamination. Breath activated meter dose inhaler. It is used in the conjunction with the pressurized meter dose inhaler. It reduces the patient variability and patient coordination errors. So it helps to improve the compliance and adherence in patients with asthma and chronic obstructive pulmonary disease. Now we can see how the breath activated meter dose inhaler is working. here it is designed in such a way that when we are opening the mouthpiece, the priming of tubing will be taking place. And once the patient started inhaling the medicine, the tubing will become straightened and it will be delivering the appropriate dosage of medication to the patient. The advantages are, it is having the high efficacy, it is very well compact, portable and convenient for the patient to carry all the time. It doesn't require any patient coordination and less skill is required, and no need for the usage of spacer, and it is coming with the dose counters. So very easily patient can identify how much remaining doses are there. The next type is the dry powder inhalers. In this, there are special devices are used to inhale the medication which is available in the dry powder form. This powder form medication will be packed in a capsules, and the device will be helping to deliver the medicine from the capsule so that the patient can able to inhale it. There are mainly two different types of dry powder inhalers are available. First one is the single dose dry powder inhaler. In this, each time the patient has to load the medication. The capsule has to be loaded inside the inhaler, then the patient has to use it. The next one is the multi-dose dry powder inhaler. Here, like other aerosol medication, there will be a multiple doses of medicines are there in the device for usage. We need to educate the patient that how to use the dry powder inhaler. Ask the patient to remove the cap from the mouthpiece and open the inhaler. Then they have to breathe out, then place the mouth with the mouthpiece and administer the medicine, then breathe in deeply through the inhaler. They have to hold the breath and count 10, then they can breathe out slowly. Then once the administration is over, just clean the mouthpiece and keep it closed. It is a type of breath activated MDI, and in this method there will be more lung deposition of medicine is possible. It doesn't require any spaces, as it is not need for more technique and coordination. It is so user friendly and it doesn't have any propellants. If the patient effort in inspiration is weak, that will be leading to the poor intake of medicine and will be leading to the less effect. And also it needs the reloading of the medication. Because of the reloading, it will be difficult for elderly people to handle this device. And as the medicine is in the powdered form, it will be sensitive to moisture and very easily it will be getting spoiled. As the meter dose inhalers are based on the self administration, it is highly needed to educate the patients regarding the techniques and the effective usage of the meter dose inhaler. We need to explain to the patient regarding the medication action and side effects, and also how to maintain the device, like cleaning the mouthpiece is highly important to prevent the infection. When the patient is using the corticosteroids, it is highly needed to take a mouthwash following the medication administration. This session we have learned about the meter dose inhaler and the different types. It is highly suitable for the emergency needs of the patient, especially those who are suffering with bronchial asthma and chronic obstructive pulmonary disease. In this, the patient can administer medicine by themselves at any place, at any time, because easily they can carry the device with them all the way. And the patient education related to the usage of device is highly important. For this, I have referred the fundamentals of nursing textbooks and from the internet. Hope this video will be useful to you. Thank you for listening.